Hello, my name is Eva, and I'm going to present my teaching learning project designed for professionals, assistive personnel, and adult medicine patient population on acute care medicine unit at Virginia Commonwealth University Hospital. The topic is anticoagulants, why anticoagulation in hospitalized patients is important, and what are the risks associated with their use. I appreciate any comments regarding teaching and evaluating methods and the needs of the audience. Thank you. Studies show that hospitalized patients have an eightfold increased risk for developing venous thromboembolism, including deep venous thrombosis and pulmonary embolism. Pulmonary embolism is responsible for about 300,000 deaths per year in the USA, and most deaths resulted from unexpected PE development in hospitalized medical patients. DVT and PE are preventable, but without prophylaxis 1 in 20 hospitalized patients may die from PE. The Acute Care Medicine Unit at the Virginia Commonwealth University Health is a 28-bed inpatient unit specializing in the treatment of adult medicine patients, and majority of these patients are at risk for blood clots because of heart disease, obesity, diabetes, hyperlipidemia, and other conditions that require prolonged stay in a bed or a chair. The population included in the plan of teaching are adult patients with low health literacy levels, care partners caring for these patients, and nurses. The most frequently used anticoagulants on acute care medicine unit are Lovenox and heparin injections. Many patients refuse the injections in spite of the education they receive from their healthcare professionals. Acute care medicine nurses need to develop better methods of teaching the patients about increased risks for venous thrombosis development during hospitalization. Nurses utilize the help of care partners to facilitate efficient and organized patient care. In order to provide safe, high-quality care, nursing assistants need to communicate the patient's immediate needs and address issues like the side effects of medications. Healthcare institutions have different educational requirements for assistive personnel, and their level of education may vary. It is the nurse's responsibility to communicate clearly the patient's condition and plan of care and educate assistive personnel appropriately. The teaching will be implemented during nurse administration clinicals during the fall semester of 2017. Patients need to be aware of risks associated with prolonged hospitalization and why they require anticoagulant therapy. Patients do not know how to recognize the signs and symptoms of bleeding and what to do in case of bleeding. Many patients do not understand medical terms, and the teaching needs to be conducted in layman terms. Care partners need to know the signs and symptoms of bleeding and what to do in case of bleeding and how to implement safety precautions minimizing the risks. Professional teaching will include the process of assessing a patient or care partner's learning needs and literacy. Some of the causes of low health literacy include difficulty listening and speaking effectively, difficulty or inability to read or write. Professionals need to learn effective assessment techniques and communication techniques. Situational factors play an important role in patient education as well. Hospitalization is a stressful experience for the majority of patients. The setting can be distracting, making it a difficult learning environment. To facilitate a patient's learning, a nurse needs to find appropriate time and set a comfortable and quiet background. The nurse should also understand that motivation affects learning, and developing ways for patient motivation can be the best strategy to facilitate learning. Very often, nurses communicate with the patient using medical terms and complex concepts. It is important for a nurse to understand that majority of patients cannot understand medical jargon. Nurses need to learn to convey medical information using plain language and simple concepts to facilitate patient learning. Professional education will be conducted during in-service session, and it will include information about anticoagulants and the most appropriate techniques for assessing a patient's readiness to learn, the purpose of anticoagulant therapy, its benefits and implications. Nurses also need to know how to evaluate learning outcomes. The purpose of patient education is to understand why the patient needs anticoagulation and what are the implications of anticoagulation therapy. Upon completion of the education session, a patient will teach back the purpose of anticoagulants, what medications potentiate the effect of anticoagulants, and what are the signs and symptoms of bleeding. The patient will also demonstrate acceptance that she or he is at risk for developing a blood clot by accepting injections of heparin or Lovenox during this hospitalization. The patient will be able to use a call bell to call a nurse before getting up to avoid a fall or to notify the nurse about any signs of bleeding. Upon completion of the education session for care partners, care partners will be able to teach back the signs and symptoms of bleeding, what to do in case of bleeding, and they'll be able to demonstrate how to implement safety precautions to minimize risk of bleeding. Upon completion of the in-service session for professionals, the nurses will be able to identify the best learning environment facilitating teaching blood clot prevention medications, demonstrate assessment techniques evaluating an adult's readiness to learn, demonstrate literacy assessment strategies, design an individual's teaching plan about anticoagulant therapy, and explain the necessity of using plain words while teaching anticoagulant management and implications. The most relevant theories used for this project are Knowles andragogy theory and Festinger's cognitive dissonance theory. Knowles andragogy theory describes 6 principles of adult learning. Adults need to know why they should learn something. They are more problem-centered than subject-centered. They are self-directed, valuing independence, and previous experiences affect how they learn. Adults need to have internal motivation to learn, and adult patients may find practical life concepts easier to understand. According to Festinger's cognitive dissonance theory, individuals seek consistency between their beliefs and their behaviors, and the discrepancy between patients' beliefs and their lifestyle causes stress that may motivate the person for a change. Knowles' theory serves as an essential guide to understanding learning principles of an adult population and for developing appropriate communication methods. Patient teaching materials will include information about blood clots and anticoagulant therapy, over-the-counter medications promoting bleeding, signs and symptoms of bleeding, and what to do if bleeding occurs. The patients will be taught through talking and discussion and answering patients' questions. The patient will receive a handout, What should I know about anticoagulants when appropriate? Because acute care medicine patients are adults, the teaching strategies and materials will be congruent with the principles of adult learning defined by Knowles. A nurse will use a handouts, one-on-one discussion, and teach-back methods to facilitate patient learning. One-on-one individual discussion is appropriate for several reasons. Anticoagulation therapy is not appropriate for all hospitalized patients, so target audience are the patients who are at risk for DVTs. Because each patient in acute care medicine has a private room, the teaching will be conducted individually. Another reason for one-on-one discussion is to give patients personalized attention. According to Knowles' theory, adult patients need to know why they need to learn something. A nurse will be able to provide teaching during medication administration when patients typically ask the most questions. Because patients want to learn what matters to them, these moments usually create an opportunity to facilitate active learning. Adult patients are engaged in their learning when the concepts are applied to their own situation. Adult patients prefer comfortable, non-threatening learning environments, so the privacy of their own room will ensure that the need for a comfortable, interruption-free setting is fulfilled. For professional teaching, a nurse will use a slide and video presentation and handouts designed for professionals. Because nurses will be educating adult patients and care partners, they need to learn adult learning principles what is health literacy, how to assess patients and care partners' literacy, how to use rapid estimate of adult literacy in medicine test, and choosing appropriate teaching and evaluating methods. Educational materials will include a list of medical terms in plain words. The teaching will take place in a conference room where a group will be able to engage in a discussion and ask questions. Video media and PowerPoint presentation will be used to present an adult's learning needs and to demonstrate the learning strategies fostering patient education. The slide presentation and the handout will be used to highlight anticoagulant purpose, administration, side effects, and safety precautions. Video media showing real-life examples of teaching strategies will serve as a substitute for a real-life experience. Handouts will be distributed before the presentation to allow professionals to refer to it as needed during the presentation and discussion. The patient evaluation will be completed by a nurse at bedside upon completion of patient education. To reduce a patient's anxiety, the patient's knowledge will be evaluated by asking open-ended questions because written evaluation may be stressful and intimidating for the patient. The patients will be asked to repeat learned information in their own words. This technique allows a nurse to gain an insight into the patient's thinking and lets the nurse understand the patient's perception. Based on the results of an evaluation, the nurse will be able to address areas needed improvement and evaluate her own performance as a teacher. Professionals will be evaluated by written feedback regarding teaching materials used in professional education to determine the effectiveness of the teaching strategies and used materials. The feedback will illustrate the effectiveness of the teacher and the content. To evaluate professional learning, the nurse will administer a post-test. It will include short answer essay and true-false questions. Based on the test responses, the nurse will be able to evaluate the effectiveness of the teaching session. The summative evaluation in the form of a rating scale and open-ended questions will be administered to evaluate the effectiveness of the teacher and the content as well. Thanks to this course, I have a better understanding of the complexity of the teaching and learning experience. Because of the new awareness, I'm able to teach my patient and peers more effectively. To be successful in patient and professional education, we need to be aware of audience limitation and consider these limitations while designing an appropriate teaching. The assessment techniques and teaching methods discussed in my project can be applied to majority of adult patients in a hospital setting. The slide and video presentations provided great examples of assessment techniques used for assessing patients' literacy, and they also provided tools for creating an effective teaching plans. Although I was quite overwhelmed at first by the project, at the end I enjoyed it because teaching opens up so many possibilities and allows teachers' creativity. Teaching can be fun, and knowing learning principles helps design effective strategies facilitating a patient's learning. Thank you. The following references were used for this project.